Welcome to Moms Every Day. We're at the office of Bret Orthodontics discussing the benefits of early orthodontic intervention.
So the American Association of Orthodontists recommends that kids see the orthodontist at roughly age 7. The reason for that is because by that age, the permanent incisors or the front teeth, as well as the 6-year molars, are pretty much developed. And at that age, we're able to assess both what the bite is and if there is any crowding development. We're also able to get a very good idea if there are any other problems developing at that time. The reason kids are evaluated at age 7 is because many orthodontic problems are much easier to address early rather than waiting until more of the permanent teeth have erupted or waiting until the jaws have developed further. One of the goals of early orthodontic treatment is to make problems easier to treat down the road. So we don't necessarily treat all problems to perfection at that age, but what we're really trying to do is decrease the severity of the problem so that once the permanent teeth come in and the jaws have grown more, it's much easier to address. The other reason we like to see them at age 7 is that most kids don't even end up having treatment at age 7. About 85% of the patients in our office don't have a first or early phase of treatment, but the simple removal of baby teeth can really help eliminate problems or at least decrease the severity of those problems. And finally, we really like to evaluate all our young kids for airway issues. There's really good research now showing that ADD, ADHD are highly associated with airway issues that can be diagnosed at the orthodontist and treated through a combination of tonsil or adenoid removal in conjunction with an expansion appliance. So 7's a really good age to start addressing both dental and skeletal issues. So early orthodontic treatment is not required and is not necessarily right for every child. Each child possesses different and unique problems that need to be addressed. Problems that are easily addressed later really don't have any reason to be treated early. It's problems such as severe crowding or severe overbites that really become difficult to treat down the road, especially underbites. Those types of problems really need to be addressed early. But the vast majority of kids we really like to monitor in what we call our growth and guidance program so that we can guide the growth of the jaws and guide the eruption of the permanent teeth so that when they do come in at an older age, they're easier to treat. So not all early orthodontic treatment eliminates the need for what we call a comprehensive or second phase of treatment down the road. Most kids that have severe problems will end up needing a second phase down the road. However, there are times where when we get the majority of the problem corrected, either the patient is satisfied, so there's not necessarily a second phase required, or we get it to a spot where their bite is completely acceptable and the alignment and aesthetics are acceptable to the patient, so they don't necessarily want to pursue a second phase of treatment. However, to be safe, we do tell most of our patients that have severe problems that need treatment early that they should plan on a second phase down the road, and if they don't need it, then everybody's happy.
For more information, go to fox28spokane.com and look for the Moms Every Day tab.